my name is Sarah Maxwell. I'm the Director of Marketing at ThriveAP. At ThriveAP, we are honored to have an expansive faculty of expert speakers and APPs with impressive credentials and experience. Today, I'm going to take a few moments to get to know one of our speakers a little bit better and gain some of their insights and advice for thriving in an advanced practice career. So I want to welcome Steven Wei.
Hi, Sarah. Thank you. Thank you so much.
Thank you for joining us and for being willing to chat with us a little bit.
Absolutely. Looking forward to it.
So I'll just hop right in. So tell us a little bit about yourself, about your background, who you are, where you live, where you practice.
Okay. So I was born in New Jersey, but I've lived in Texas pretty much all my life, including college and grad school. And I went to PA school at Baylor College of Medicine and graduated in 1999. And I've been working in surgical oncology at MD Anderson Cancer Center since then for nearly 23 years. All within the same subspecialty of GI surgical oncology, and also with the same collaborating physician the entire time. My role has definitely evolved over the years, and I'm currently a APP supervisor for a little over 12 years now.
Wow. So with that, it sounds like a very illustrious career. What would you say is, your most noteworthy career accomplishment if you had to pinpoint one, and why?
Well, I've really enjoyed serving in professional organizations, and definitely getting my doctorate, my EdD was a highlight. But if I had to pinpoint my most noteworthy accomplishment, probably it would be founding and being the chair of the Surgical Oncology Advanced Practitioner Conference, also known as the SOAP Conference. We've had several successful meetings, and we're about to plan our fourth one starting next April.
Oh, wow. Congratulations.
Yeah, thank you.
That is exciting. And as somebody who has put on events before, I know what a big undertaking that is. So wow, congratulations on that. So speaking here at ThriveAP, I know you're a little bit newer to our faculty. Tell me a little bit about what attracted you to working with our team.
Sure. Well, definitely, my passion has always been on not just patient care, but developing people with a desire to invest time and energy into developing leaders, not so much for a specific role or position, but helping people, helping others gain skills for professional communication, interaction, in order to build healthy, productive relationships in teams, leadership development in team-based practice. So that is so much aligned with what ThriveAP is doing. Especially from new graduates right out of PA NP school and starting practice in the profession. So there's definitely a lot of gaps that are missing there, and I think ThriveAP is definitely doing all that they can to try to fill in those gaps and to definitely equip the APP for sure.
Absolutely. And with that, you said you're very passionate about training leadership, helping these APPs thrive in practice. Would you say that's your greatest passion of your role, or is that maybe combined with some other aspects?
Yeah, so, being a clinician for over 23 years, patient care is always there. That's my why about why I'm doing what I'm doing. But over the years, I've really enjoyed mentorship, developing the APPs in my group and also being a resource for APPs outside my group as well. To develop their skills and develop their full potential and their leadership skills. So I would say, now that I'm sort of transitioning to the second phase of my career, I would say, I do definitely want to focus more on the people development aspect of things. So.
Well, and speaking of supporting, your fellow APPs, what do you think makes a good mentor? What do you think some of those attributes might be?
So, there are so many attributes for being a great mentor. I would say probably becoming a good listener, understanding your learner and your mentee, including their background, their prior experiences, what their goals are, having opportunities for them to articulate their goals and even readdress those goals often, because as we know, goals might change. So I think that's very, very important. It's just being available, being a good listener, and just really trying to understand your mentee as best as possible.
Yeah, no, I think that's such a great point, especially you can take that even outside of maybe a healthcare space, even just listening to your mentee and helping them understand, hey, this was my path and that was so great for me, but let me help guide you. So I think that's really good advice. Speaking of your continuing education and helping with folks, do you have any key journals or apps or anything that you could suggest to maybe some earlier career APPs that, hey, here's a great spot to stay abreast new information and new procedures?
Well, there's definitely a lot that's out there. For me personally, I am an editor, associate editor for one of the journals, Journal of Advanced Practitioners in Oncology. So I would say that I read that the most. In my profession, in my clinical experience, I read a lot of journals that are like Annals of Surgery, Journal of Clinical Oncology, or JAPA, just to name a few. I'm not as familiar with some of the apps because we have a lot of clinical resources available to us working in a large hospital that's readily available there on our phone, like up to date and things like that. But I would say I do read quite a few journals when I do have time. So.
Yeah, it sounds like you've just got tons of time with everything you're involved in. Gosh. Well, speaking of, I'll hop here kind of to our last question because I think we've taken enough of your time today. Lastly, what kind of advice would you give to APPs of today so they can prepare for a successful future?
Well, that's a great question because over the years I've seen several APPs really thrive and do well and develop their relationship with their collaborating physician, and then I've seen some that haven't done very well in their practice and their partnership with their physician. I would say first and foremost is, there's going to be ups and downs. There's going to be struggles, frustrations, even possibly burnout at times. But we should always be reminded of our why in becoming an APP in the first place. So, that goes a long way, whether that be a passion for patient care, education, empathy and being compassionate caregiver. Those are very, very important. And working at a cancer hospital, even though things can be very difficult at times, definitely, our mission is very clear, and that is to end cancer and to be there for our patients and help them through some of the hardest times of their life. And that could be the same for pretty much any provider, is that we really are instrumental in where we are, with our patients and being there during some difficult times, and so I would say that's very, very important. I find also getting involved in, professional development, education, leadership development has really helped me rekindle the flame, sort of less an APP. So.
Gosh, I think that's amazing advice. Remembering the why. I think that's, I don't think you could get better than that, right? And then, like you said, if there's an opportunity to kind of get back and contribute, that is one of the things I've found to be the most exciting about the healthcare space, especially with advanced practice providers. There's so many are so willing to give of that very limited time y'all have to help with the next generation of APPs. So thank you for everything you're doing. And
sure, absolutely.
Gosh, yeah. And thank you also for being here with us today and sharing your incredible experience and this amazing advice. We're very appreciative.
Thank you. Thank you so much, Sarah.
Yeah. And thank you everyone for joining us today, and stay tuned for more of our Meet Our Faculty. Have a great day.